me to ask a quick question.
All right, everyone, welcome. It is Thursday, March 19th, 2020, coming to you from Athens-Clarke County City Hall. We're here for our special called session, and given that there will be a vote held tonight, I'm going to ask Clerk Spratlin to call the roll.
Davenport. Here. Parker. Here. Blink.
She's there.
Wright.
Present.
Denson.
Here.
Neesmith.
Here.
Edwards.
Here.
Harrod.
Present.
Thornton. Here. Hamby.
Here.
We have a quorum.
All right, I appreciate it, Madam Clerk.
Here too. I didn't hear my name called, but this is Melissa. Melissa Link. I'm
We saw
here.
you.
Okay.
Thank you, Melissa. Clerk, Commissioner Link is here. As was the case on Monday, we have some commissioners joining us remotely. Commissioner Link, Commissioner Wright, Commissioner Edwards, and Commissioner Harrod are all joining us remotely. And under emergency powers, they have the same voting power as if they were here in the chamber. Purpose of the meeting tonight is to consider airport capital improvements, an update to the emergency management ordinance, and an update to the declaration of a state of local emergency. Typically, we would have public input at this time. We apologize that given the crisis, we're not able to have people in the chamber. And given the volume of input, I am entering everybody's comments into the record that were received via the portal. And so your name, your complete comments, and your topic of interest are all entered into the record. We very much appreciate everybody's interest in commenting in this challenging time. We have one item of old business to take care of. That is the TSPLOST Project 2018, Project Number 1, Airport Capital Improvements. We have a federal grant for Taxiway A reconstruction and realignment, including the apron expansion sub-project. So any input on this item from any commissioners, I'll just ask first in the room, and then I'll call upon those digitally present in order. Commissioner Neesmith?
I just hope we will move this forward. There is a timeline in order to respond to GDOT for the funding that they're providing. If you do the quick math, you can see that the funding we're getting from GDOT and from the FAA is a little over 9 times what we're providing. We're providing funding from a speed loss proposal or referendum. And so this is a highly leveraged, this is for taxiways and apron expansion so that we can park more planes at the airport, which we need now. This is not in preparation for commercial service. We need this now. For example, when Notre Dame played ball here last year, we had 150 airplanes land there in one day, and there was no room to park them. We had to send some of them away.
Thank you, Commissioner. Yeah, Attorney?
We had discussed the need to amend the agenda tonight to discuss the litigation matter.
Yes, I apologize. We need to amend the agenda tonight for a special called session following the regular session. Could I hear a motion for update of the agenda to include?
Second.
Okay.
Litigation.
That's include discussion of litigation in closed session. Got a motion from Commissioner Neesmith to amend the agenda, a second from Commissioner Denson. All in favor?
Aye.
Aye.
Any opposed? All right, motion for amendment to the agenda carries. Thank you for your input on the airport. Commissioner Neesmith, any other commissioners in the room interested in weighing in on the airport apron expansion grant? All right. Commissioner Wright, any comment on that item?
All good. Thank you.
All right. Commissioner Link?
I'm good. Thank you.
Commissioner Harrod?
Works for me.
All right. Commissioner Edwards?
All good.
All right, thank you, folks. All right, I'd certainly entertain a motion for approval of this grant.
So moved.
Second.
All right, is this an ordinance that needs reading? Attorney Drake?
Yes, it is. An ordinance to amend the Code of Athens-Clarke County, Georgia with respect to emergency management and for other purposes.
All right, all in favor?
Aye.
Any opposed? All right, motion carries. Thank you for that. All right, everyone, as we begin discussion of our emergency management ordinance and our state of emergency, we're going to have what amounts to a mini work session. We're fortunate to have a couple people in the room tonight for public health and a couple of video presentations that we'll be getting relatively briefly. and one letter from a consortium of doctors that they would have been presenting via video had technology allowed. So I'm grateful to be able to introduce Emily Pennington-Eisenman from Public Health and her colleagues. I'm going to allow them to approach the podium.
Thank you, Mayor. I am here representing the Northeast Health District, under which the Clarke County Board of Health operates. At the request of the Clarke County Board of Health, I wanted to share with you some of the things that Public Health is doing right now, particularly focusing on some of the messaging that we're doing. Both Commissioners Wright and Commissioners Link are on the Clarke County Board of Health. So some of the things we talked about in a recent meeting, we're preparing a poster on social distancing with the intent that this would be provided to area restaurants and bars primarily. I believe I have that correctly, Commissioner Link. So again, I'm still in draft form. I expect to have these done tomorrow, but we're looking at a very graphic poster like this. It would be an 11 by 17 format that restaurants and bars would put on their, I guess, on their front door and their front window, so that people coming in are just aware and thinking, if they've missed messaging completely, that social distancing is really important when they're in this establishment. Another thing that we talked about are some sort of material that we can give to law enforcement when they are out and about and they see, whether it's groups or people that they feel they want to impress upon them the importance of social distancing, and just, again, making aware. I think, all of us in here are very aware. We're tuned in, but there are a lot of people who aren't. Maybe they just don't watch much TV, aren't watching the news. We're concerned that there are people who are not as aware as all of us here are. So we're looking at, this is a little oversized. It would be a thinner rack card, so it would fit in the pockets of law enforcement. Could be used in other places as well, but very bright and very graphic, and so that law enforcement, or really anyone, but I think, Commissioner Link, this was intended to be law enforcement, to remind people, hey, you're out here, you're downtown, you're in a group, be aware here. So this would be a double-sided. Here we, stop the spread of COVID-19, and maybe some symptoms or something like on the back. This is not quite done yet either, but that's the type of thing we're looking at. Another item that we talked about, and it turns out ACC government is already doing this, so it's great. They have already done a flyer that I think starting tomorrow, is that what he said, will be in the school lunch programs. I don't know if you all have seen this, but we were pretty impressed by it. Stay triple safe, stay clean, stay home, stay back. Just very good informational, and it'll be put in with the school lunch program. I think it'll be, I think, double-sided, Spanish on the other side, and this can also go to food pantries and other places. Just a broad informational message here. And then one other item that we're doing, focusing specifically on businesses. I don't have anything to show you yet, but we are working on the text of this. There has been some concern with places like hair salons, nail salons, massage parlors, gyms to an extent, although I think the gyms could also have this poster up, that we need some very industry, business-specific type materials to share with the businesses to make sure that they are aware, make sure they're following best practices. So we're envisioning something specific to the various, as I said, nail and hair. Massage would be a little different. Probably a trifold brochure that will talk about how to protect your employees, how to protect your customers, best practices, that sort of thing, where to call for more information. Our environmental health office will head that up. We'll go to businesses with those industry-specific brochures and take them around. Now, we as environmental health only technically regulate restaurants, bars, and tattoo parlors, but we certainly are wanting to share information from a public health perspective to all these industries. We'll also have a generic one. In some brainstorming sessions, we thought about like tidal pond places. They may very well be open, have a little lobby, so we want to make sure that they're aware of wiping down surfaces, keeping chairs apart, and that sort of thing. And then just some general retail, wiping down cash registers and anywhere customers may touch. So we will be doing those out and get those out to businesses in the area. So that is really our big messaging push over the next few days, and I'm happy to answer any questions if you have them. Okay. Yes.
I have a quick question or comment. This is Commissioner Link. Regarding the rat cards, I think it might be important to include some of the language or a quick summary of the actual recent emergency laws that have been passed, public gatherings and the shelter-in-place laws. We're about to enhance that. I do believe Chief Rural might have some input. Officers' role in educating the public and the need to keep our officers safe and properly socially distanced. So we might need to rethink how we get those items out into the public. But I would ask that you coordinate with ACC management to get some, brief summary language onto those cards that can communicate the actual law.
Okay, that's a great idea. So, we've got this very graphic here on the front talking about social distancing, that sort of thing. On the back, we didn't really have this fully filled, so we've got definitely room that we could put summary for law enforcement, especially if they're encountering someone not following the guidelines. Yeah, we can definitely add that. Thank you, Commissioner.
My question was,
Yes.
I do know that the East Athens Health Department has taken the initiative of being proactive, and they have a flyer or they have some information
Yes.
as you walk up. So I'm assuming that when these are rolled out, they will get that information also.
They will, and you're correct, Commissioner. Our health departments, including East Athens and the main clinic, already are using some signage, some guidance for what to do if you think you're sick. What we discussed with the Board of Health for this messaging package was particularly focused on the businesses who are still seeing patrons. So that's what we're focusing on, but definitely these same sort of materials will be in the health departments, but you are correct, the health departments are really a step ahead of this already. That's one of the first things we do is make sure our health departments have good signage and following practices, like in the East Athens location, particularly because it can get very crowded. They're limiting the number of people who can get into the waiting room at one time because that's what we have to do. That's just a very, very busy and a smaller clinic, so.
And my other question, I know when I brought this up before, we seem to try to separate the neighborhood day center for the homeless. We want to say that's dorms or whatever. It's almost, but I drove by there today and I know, just driving by, I know there were like 30 people outside just sitting around the tables. And I think when we try to separate those kind of gatherings, we're missing a large group of people. And I don't think we should just limit, I guess my point is, I don't think we should limit that messaging to just businesses. I know this is unusual times, but there are already places that are traditionally where people gather that may or may not get this information anywhere else. So I don't want to just limit it to businesses.
I totally understand that. That's a very good point. I've noted homeless centers and other places. These are not so specific to restaurants and bars. That's just how the conversation started. But these will be great posters for anywhere, and they will be widely available for commission to get out to anyone, as well as our staff can as best we can. But that's a great point. We have to think about certain populations that may not have as much access to the news as we do.
And I do like that it's not a whole bunch of words. I love the little cartoon things there.
Right.
People are not going to want to walk by and just read. So I like it because it's eye-catching and it gets the message.
That's right. And the minimum size on this would be twice as large, and it could even be scaled up if if there was a need to have them at 24 by 36 or something like that. But yes, I've got good graphic people really to make it eye-catching. That's half the battle, getting people to look at it. So, thank you for your questions. Yes, sir.
Thank you. My question, I guess, was more on what is being done, are these things being distributed, and what else is being done in the rest of the Northeast Health District and the other counties? What steps are being taken?
Okay, well, let me give you a little bit of a summary. We are doing testing now, as is the case all over the country. Supply limitations have been the biggest hurdle, swabs particularly, but testing kits, but swabs particularly. The State Department of Public Health is aggressively working on getting more stock, and we have reached out to our private labs that we partner with. We are in a much better place supply-wise than we were earlier this week. We are having a drive-through testing site. And it is due to the limited availability still of testing kits. There are priority groups that we're focusing on first. We are planning to staff this 5 days a week for now. We can change that depending on demand and supply availability. So that's something we're very very involved with. We do have an emergency preparedness department that kind of heads up those sort of mass things like that. So we're doing testing. Education is another piece. We are also doing contact investigation for positives and presumed positives. And basically we're monitoring the situation very closely because it is evolving, quickly evolving. So that's, we wish we had more tests, but we are doing what we can with what we have right now.
On with the messaging and the communication parts, I guess that specifically, like these materials that y'all are getting, they look great. But are those materials going to be distributed in these other counties also? Are they going to also be having restaurants stuff put them up? Because I think, we're the smallest county in Georgia,
Right.
have so many counties touching us. Oconee County's just across the river. Just want to make sure that we're not, our actions aren't being somewhat diluted on the edges of our county.
Right. That's a very good point. And the Northeast Health District encompasses 10 counties. So these materials, we've started because the Clarke County Board of Health was the first to come to us with the concerns about the restaurants, probably because of the number of restaurants and facilities like that here in the county. But we definitely will be rolling this out everywhere. And we feel on the business-specific brochures, not a few in Clarke County, but particularly in some of our other counties, there are some other factories and that sort of thing that we want to make sure that those factories are understanding how to keep their employees safe, cleanliness procedures, what to look for, and that sort of thing too. So the market in each of the counties is a little different, but these are going to be district-wide. They will, I don't think we have anything that specifically even says, just says Northeast Health District. If they did say a county, we'd customize it for each county, but we're keeping it very, saying Northeast Health District, and we will use it in all 10 counties. Other districts as well, we share information, so we might even, you might see this over in Gwinnett if they like our design.
Okay. Great, thank you.
Thank you so much.
Well, I think Commissioner Dapp.
A couple more questions. But first of all, thank you. I think I've been preaching for the education part for a while, but thank you for all your work. Can you talk about a little bit about the priority and those who don't fit the top priority? What's the protocol for those individuals?
Sarah Peck is our public information officer, and she's probably best to say that specifically without me tripping over the words.
Sure.
Go ahead.
The priority groups include those who are symptomatic, healthcare workers, individuals over the age of 65, and those with chronic health conditions.
And what's the protocol for an individual who doesn't fit those criteria?
They can reach out to a private healthcare provider and be assessed that way and potentially access a test that way. But from our perspective, we are only reaching out for those groups. Those are our priority groups. Yep.
Thank you.
I think there's a correlation with although the health department, it serves everyone, we do focus on those who don't have other resources often, and so our testing is similar because the testing is limited. It's similar. If people do not have a private doctor, we are who they should call. Okay?
Could I say something, please?
Yes.
Hi, Ms. Eisenman. It's nice to see you again.
Thank you.
We saw you maybe,
Just a few weeks ago, right?
yeah, 4 weeks ago or something. I asked you then about the coronavirus tests and how we can get those here in Athens, Georgia. The epidemiologists are telling me that it's critical that we get tests so we can expand testing to understand the scope of this virus. Can you tell us when we can expect to have more tests? Like what date?
I'm not sure I can give you an exact date. I will say we have
Okay.
a lot more than we had on Monday. Sarah, can you add anything to that?
So I don't have a specific number or timeline for getting tests, but I will say we are expanding our testing capability literally daily. We've made a tremendous push statewide to increase that testing capability. So we can do probably about 20 to 25 tests a day right now from our testing site.
That's how many we're processing, or that's how many we're collecting? That's how many swabs we are collecting, 20 to 25 a day?
That's how many we have the capability for at the moment
Okay,
to
gotcha.
process.
And we collect only. They do have to be sent to a lab.
That's right. So how are things going at the lab where they process these tests? Or is there a backlog, or what's the turnaround once we turn in a test? How soon can we find out the results?
There's some variability, about 3 days on average.
Any idea when that might hasten, when that might,
We have more
move that
private labs
timeline
and
up?
commercial labs on board now, and the turnaround times do seem to be getting shorter.
Okay. Thank you for sharing information. I think that's vital right now. The public is thirsty for information about how this pandemic is being responded to. So thank you for coming tonight and sharing that vital information.
I just want to piggyback on that. And when I met with the health department today, they have 14 kits. 14. I've already put my reservation in for mine, so I want them to know if I need one, they need to set me one aside. But we need to, that's really important. I think that is going to be the crux of this whole thing, is people being able to get tested and tested accurately instead of blanketing a whole community. And I think it contributes to the fear, but 14 test kits is just unacceptable at this point. And I'm not blaming anybody. This is new, I get it. But that is one of the things that people don't know, is that we don't even have the tests to test people.
We have more capacity than we have tests, and we are only doing this testing in Clarke County. I have 10 counties. We could be doing this in all 10 counties if we had the testing, but we are, with Athens being very centrally located as well, and really our largest population-wise in our district, that's where we've started. But we definitely have the capacity, and we can ramp up our capacity as the tests are available for us to perform. Yes, Commissioner.
So to clarify on that, we're saying that we have 20 to 25 tests for 10 counties?
No, Sarah says
Daily.
we do about 20 to 25 per day. It takes
Okay.
a little while to do the sample, and I think we do a rapid flu test as well in conjunction to rule out flu. And so we have about 9 nurses at the site, and it's a drive-through as well, so each car has to be dealt with.
Yeah.
And we can, in an 8-hour day or 7-hour day, whatever the length of the hours we're open, can process 25 tests a day. We don't have just 25 tests, but we can do 25 people a day.
Okay, but that is the testing site for all 10 counties, though?
Currently.
Currently, that's right. Without more tests, opening more sites means less tests per site. So.
Right, and I think that's what I was trying to get clarification on, okay. And I know this is like hard to say, but from my understanding, and I don't know if y'all can just throw an estimate out there, but it seems like there would be a lot more demand. Like, there's a lot more people who our health experts believe need to be tested. And any idea what that number would be? Like, basically, if we were at what number of tests and testing should we be at? If the number of tests wasn't limited?
I don't have a number for you. CDC's guidance on who should be testing and who should be a priority group is continually expanding. So as we do have access to more kits, you can expect to see that guidance increase so that more people will have access, but I'm afraid I do not have a timeline for you or an exact number of people that we would expect to test.
I have a quick question, if you don't
Yes.
mind. Thank you. So, and I don't, the 8 cases that have been confirmed here in Athens, according to the Department of Public Health site today. Now, how do they do that? Is that based on the individual's residence or the county residence, or is it based on the hospitals?
It's the county of residence.
So the 8 folks are from Clarke County.
Have a residential
Have a- yes.
address.
I got you.
Address
Okay.
of record.
I had
would
that
be
question
Clark
asked to
County.
me today, and I'm,
Yes.
okay, good, thank you.
I had one more question, sorry. What can we do to help you get more testing kits? What do you recommend we do? Do we need to contact our federal officials? I guess so, right? It's coming from the federal government.
Well, there's a combination. Private labs also have them, but because everybody is wanting them, I know they limit the number that they'll ship out to anyone. We've gotten what we can. Let us get back with you if we can come up with some good thoughts on that. We get them wherever we can, however many we can. I don't honestly know exactly where the logjam is on that. Remembering too, it's not just, it's all across the country experiencing the same thing.
So if we were to find tests available, we should call you, and then you will be able to distribute them throughout the county.
We could coordinate that, yes.
Yes.
Okay.
If you're going to
All
show
right.
up with a case of tests, come on.
Yeah. Okay, great. Thank you.
Okay.
Yeah.
Yes, Commissioner
Hi.
Wright.
Hi, thanks for being there. I have several public health reasons to be at home. My question is, the 10 counties that you guys cover, are Barrow and us the only ones that have positive cases?
I believe that is correct. I don't know that I looked at today's numbers,
As
but it was
of
there.
noon today, yes.
Okay, thank you.
Yes,
Thanks again for your information. It's very important.
thank you.
This is probably more a bit of information than a question. I received notice, or a note today that there's a group of people in Atlanta going door to door offering to do tests for the people at home at a fee. Obviously, this is a ripoff.
Yeah.
I think it needed to be mentioned so people, if we have that experience here, you'll know. You're not sending people door to door to do that.
No,
You don't know of
no.
anybody that is, right?
No,
Right.
No.
Okay, thank you.
no, I can't
No.
speak for, Fulton County, but I really doubt that, no. It's not the kind of test you would do door to door.
No.
No.
It doesn't meet any of those criteria.
No, mm-mm.
So in your development of literature, would you consider doing something to let people know that these scams might be out there ahead of time?
That's a good point, and I think,
It hasn't hit here that I
right.
know.
Are we doing some radio as well?
We don't have a radio spot right now. but
Oh,
yeah, we
okay,
have some-
but that's something we could look at as well, as trying to get that out on the radio, be careful about scams or that sort of thing. And we appreciate you letting us know anything like that you hear. I mean, we, by tomorrow, may hear that as well. But yeah, that's really a good point, and we can make sure that we incorporate
It's
that.
happening in multiple communities across the country.
Yeah. Okay. Okay.
Any other input from folks online?
Okay, thank you so much.
Thank you.
Thank you.
Back. Thank you, Ms. Eisen. Appreciate it. Thank you very much. Just following up on kind of one element of the conversation, I just want to make it clear to the public that there are other locations rather than just public health that provide testing. And Manager Williams and I have seen each other a number of times today, but we've been both very busy. Manager Williams, have you heard any more information about the kind of drive-through or stand-up clinics that are being developed by some of the other hospitals or agencies?
No, but we have a call tomorrow, and there's a number of questions we want to ask that I think mirror some of the questions that you have about how we can, augment what's happening here for the good of our citizens. I'd also like to say briefly that the police department has already warned about these scams through the media, and that's been issued as well, and we'll continue to do that.
Great.
Mayor, do you mind if I ask Manager
Please.
Williams a question about the conversations that are ongoing? So when you find this information out, will y'all put this will Public Information Officer Montgomery put this out on the website so that people know that, I just want, you see where I'm going? I mean, for us to be real proactive in getting the information out there.
The information related to testing?
What testing and the mobile sites, where they may be, and how that's going to develop.
Yes, sir.
As it moves.
Yes, sir.
If it's in.
Absolutely, and I think Piedmont Regional has a testing site over in Oconee.
Yeah.
There is testing that happens at people's private offices as well, as y'all have alluded to.
Right.
We started an effort to try to capture the number of tests that are going on, but it's imperfect because we can't track all those individual.
And I guess putting the requirements up about the test, because I know probably the hospitals don't want everybody. I'm sure they want a phone call or something first before they. I don't know
Yes.
what the requirements are, but I guess.
Yeah, the hospitals
Good
both
idea.
would ask that you call ahead of time rather than just showing up. That allows them to be prepared and allows them to do some pre-screening as well, so they understand the nature of your symptoms.
Yeah, because I think I've read where the one in Oconee, you need a reservation or something, and then so they're expecting you.
That's right. All right, we have a couple more work session presentations. The next one that staff are going to be queuing up as I'm speaking is from the Department of Public Health at the University of Georgia. It's essentially a narrated PowerPoint presentation. We've limited the number of people in the room tonight for everybody's benefit. And so this was prepared by the Dean of the College of Public Health at the University of Georgia and Grace Bagwell Adams, who you've worked with before. So I'm going to go ahead and let staff play this for us.
Good evening. My name is Dr. Grace Bagwell Adams, and I am on faculty in the College of Public Health at the University of Georgia. I'm also the principal investigator of the Athens Wellbeing Project, and that project is championed by our Athens Area Community Foundation. Before I get started, I just want to say thank you to the institutional and community stakeholders that have made this project possible. And also say that the purpose of this presentation is to serve as a subject matter expert at the request of Mayor Kelly Gertz. I work for and represent the University of Georgia, and as such, I do not have a financial interest in the outcome of this session. I'm a neutral contributor in today's session. I am neither for or against the ordinance proposed or any other policies presented in today's session. The mission of the Athens Wellbeing Project is to empower the Athens community with meaningful data that will lead to more informed decision-making, improvements in service delivery, and greater quality of life for our citizens. The presentation objectives tonight are to provide an overview of our current hospital service area, to address the COVID-19 pandemic in Clarke and surrounding counties, to identify the critical areas of health provider shortages, and to explain the major barriers to health access in our community. This presentation was prepared by myself in addition to Dr. Justin Ingalls and Megan Bramlett, and we are at the University of Georgia in the College of Public Health in the Department of Health Policy and Management. I'll start with an overview. 3 quick takeaways or findings from the data for any of your COVID-19 efforts. The first is that we have a critical regional labor shortage. Our healthcare system is already short on healthcare providers. We need more providers, especially in Athens-Clarke County. The second is that our hospitals serve a 17-county region, and that most of those patient visits come from Athens-Clarke County and the surrounding contiguous counties, which totals to over 440,000 individuals. Many patients from surrounding counties needing hospitalization will come to Clarke, as they already do. The third is that vulnerable groups compose the majority of our population. This is both in terms of chronic conditions and older adults, but also socioeconomic status. Homeless and transitional families, older adults, and those with underlying conditions are most at risk for the disease, and over 60% of our population falls in one or more of those groups. But a significant population in our county also relies on the emergency room as their regular provider of care and do not have a primary care provider. I just want to pause for a second and talk about the economic implications before we continue. This pandemic has serious implications for our workers and our service economy in Clarke County. It's really unclear how long this is going to last. The truth is that we don't know. But many small businesses in our community and those who already suffer great hardship socioeconomically are going to suffer. This is particularly difficult for families with children who are under school age and of school age, as these facilities are mostly closed at this time. Before this crisis, 7% of households in the Athens Wellbeing Project data in 2018, before any of this occurred, said that they feared eviction in the next 3 months. That's around 2,800 households if you aggregate it up to the county population, which is a significant amount of families who are fearful that they will not have adequate housing or any housing. The next thing I want to say is that we must have adequate testing and the resulting data from that testing to model the disease more precisely. At this time, we really do not have the data or the tests that we need to project or to model incidence and prevalence of COVID-19 in the community. And so that's just important to note as well. First thing I want to do is talk about the hospital service area in terms of digging down into the local data. Our two main hospitals serve patients in 17 counties, and that is not just Clarke and our contiguous counties, but also really a region. So our hospital service area is regional. And that population is large. In the primary service area, which includes Athens-Clarke County and the contiguous counties, the population served totals over 447,000. In the primary plus secondary area, the population served is over 627,000 residents. So what does this mean for COVID-19? The bottom line is that local government and hospitals really must coordinate with our surrounding counties, given the fact that Athens-Clarke County is the health services hub for our region of this state, our region of the state. Just quickly, let's look at the healthcare labor force as well. We really are in a health provider shortage area. That is a federal designation. That is something that we knew far before any of this ever happened. That's been the reality of our region and certainly of our county for a long time. This is nothing new. If you look at the total number of registered nurses, according to the Bureau of Labor Statistics, the rate of RNs per 1,000 people in our primary service area, which is Clarke and contiguous counties, is 4.26. If you look at the nurse practitioners, primary care providers, and active medical doctors, the story is much the same. Why is this important for COVID-19? Well, again, we were already operating in a federally designated health provider shortage area with providers in critically short supply. Right now, we have about 1.3 active medical doctors for every 1,000 people in the service area. The next thing I want to talk about is high-risk groups. What are the high-risk groups? Evidence shows us in regards to this pandemic that the high risk include older adults, individuals with underlying chronic conditions, those who are smokers, and certainly those who are immunosuppressed. These groups are more likely to require hospitalization and die. And so the next question becomes, okay, really what percentage of our community falls into at least one of these groups? Well, we looked at Athens Wellbeing Project data, and about 60%, 59.8% of Athens-Clarke County households have at least one chronic condition. 9% of households have an adult age 65 or older, and 7.6% of our households have someone 65 or older and at least one chronic condition. What does this mean for COVID-19? Well, the majority of Athens-Clarke County households have at least one household member that is high risk. And so extra measures should be taken to protect those individuals. I also want to say that although these data focus on Athens Wellbeing project data, which are Athens-Clarke County specifically, if you look at the prevalence of chronic conditions in our region and our service area for the hospital, it's very much the same. We have many, many households in this region who contain individuals who have one or more chronic conditions, and certainly many older adults in the region as well. The next thing I want to talk about is healthcare access. What you should know is that we have an astounding percentage of Athens-Clarke County residents who only have health care through our emergency room. This has implications not just for the fact that many people have very few options in terms of treatment or where to go for health care provision, but also in terms of the exposure and spread of this disease. According to Athens Wellbeing Project data last year, 20% of adults had their insurance refused by a provider. 39% in our sample had an ER visit. And among those with an ER visit, 28% depend on the ER as their primary care provider. This issue is much lower for children. 33% had a child visit the ER, and among those with children who had an ER visit, 14% depend on the ER as their child's source of primary care. But the bottom line is that approximately 10% of Athens households, or around 4,000 households, depend on the ER as their source of primary care. This is very important to note, especially given that with COVID-19 we may see, of course, an increase in the number of individuals or households who need to go to the ER for care. Finally, I want to say, again, looking at the vulnerable population, we have a large percentage of individuals in Athens-Clarke County who do not have health insurance. The bottom line here is that health insurance has decreased in the last year nationally, statewide, and locally. We have about 19% of our population that does not have insurance. This means that about 1 in 5 households in Clarke County do not have health insurance coverage. This significantly decreases access to care and potentially health outcomes, and is a special consideration, of course, during the COVID-19 pandemic. The last thing I just want to say about healthcare access is that it's complex. It's about supply, which we've already talked about. That supply is not just about having a location to get care and having a provider to provide that care, but also having insurance coverage, transportation, the income that you need to pay for the care, and certainly sick leave from work. We certainly don't have enough providers for the population, as we've already shown, and we have many who do not have health insurance. But we also have an issue because many of our workers do not have sick leave so that they cannot get to the doctor. Finally, many also do not have access to reliable transportation, and this is especially an issue in our surrounding counties where families often have to travel to the hospital. Okay, so as I close, I just want to say this. The College of Public Health at the University of Georgia is really here to help. I hope that you've learned some things about healthcare access, healthcare infrastructure and supply. And if you take anything away, again, please do just remember that while we're here tonight to talk about Athens-Clarke County and our policy response, our hospitals and our healthcare and social services infrastructure, our nonprofits in this community, and our businesses serve a region. We are a regional hub for social and health services provision, and that's an extremely important consideration that we have learned from the data, not just from the Athens Wellbeing Project and secondary data, but from our hospital system as well, because we coordinated with them to complete the community health needs assessment requirement last year. And so it's very clear from the patient visit counts that the hospitals in our community serve a region, not just Athens-Clarke County. And so any coordination that is possible between and among cities and counties is going to be advantageous as we face this pandemic together. I want to thank you so much for your time, and I also just wanted to include my email here at the University of Georgia in case any of you would like to get in touch and have any questions. This slideshow will be posted later this evening on the Athens Wellbeing Project website at www.athenswellbeingproject.org. Thank you very much for your time.
All right, so in continuing to provide some context for the situation in which we find ourselves, as we can see from Dr. Bagwell-Adams' presentation, we're critically strapped already in terms of healthcare providers in the area, and simultaneously have this high-risk population, not only here in Athens-Clarke, but in this broader 17-county area. So I think that lends some context for what we're doing here tonight. To provide further context, staff is going to queue up a short film from one of our local ER doctors, Lewis Ernest.
Hi, my name is Lewis Ernest. I'm an emergency physician. I'm on shift right now. And I just finished seeing another patient with coronavirus. We've seen a dramatic increase in the number of these cases over the last 2 weeks, and we expect that to get exponentially worse unless you take dramatic action tonight. You're trying to do two things here. You're trying to prevent a collapse of the healthcare system, and you're trying to buy time for more treatments to be developed. There's a high likelihood if y'all don't act tonight and you or one of your loved ones gets sick, that if you show up to a local hospital, that you will not be able to be provided care. We just won't have the capacity to care for you. Please take action. Please take it right now. Thank you very much for your leadership.
All right, and echoing those same sentiments, we have a letter from a consortium of physicians who, again, given a desire to have limitation on the number of people here in City Hall tonight, have written rather than provided a presentation. But I want to let you know who this letter is from. It includes Mark Abel, MD, a family physician, Shelley Nuss, MD, a general internist, Jose Cordero, MD, a pediatrician and former assistant surgeon general, Chris Whalen, MD, an infectious disease physician, April Lowenthal, MD, a family physician, Bill Williams, PhD, former chair of the State Board of Health, David Lockman, MD, an infectious disease physician and dermatologist, Andreas Handel, PhD, an epidemiologist, Shangwai Li, PhD, an epidemiologist, Neil Priest, MD, emergency physician, Ye Shen, PhD, an epidemiologist, Dale Green, MD, a pulmonary physician, Thomas Weiner, MD, a family physician, and Brett Wagner, MD, another family physician. And they write, Dear Mayor Gertz and Athens-Clarke County Commissioners, we are a group of medical and public health professionals in the greater Athens area with expertise in primary care and emergency medicine, infectious disease, public health, epidemiology, and disease modeling. We feel strongly that we are at a critical point in this pandemic and that a failure to act now will lead to a much wider spread of COVID-19 in Athens and risks overwhelming our hospital's capacity. Therefore, we want to summarize some important points that are based on the best available data from scientists around the world. 1, this virus causes a serious infection in some people and is estimated to be at least 10 times more deadly than seasonal influenza. It is not a, quote, bad flu or, quote, bad cold. The overall fatality rates for infected persons is about 1 in 100, compared to 1 in 1,000 for influenza. It increases to 1 in 50 for people in their 60s, 1 in 20 for people in their 70s, and 1 in 10 for people in their 80s. Importantly, these death rates are much higher for persons with chronic diseases like diabetes, emphysema, and heart disease. And some supplemental materials are provided that I'll provide to you. Number 2, COVID-19 spreads relatively easily, with each infected person infecting 2 to 3 others. There are almost certainly 100 or more cases in Athens that are undetected. So in just 2 weeks, 100 cases could become over 600 without mandatory social distancing. In a cluster in China, a single infected person spread COVID-19 to 23 of 68 people on a bus line in less than 2 hours. Number 3, one of the best infectious disease modeling groups in the world is at Imperial College in London, England. Their job is to predict what will happen in a disease outbreak or pandemic. They published work yesterday that shows clearly that the more the following steps you take, the lower the likelihood that our health system will be overwhelmed. These are the things that we need to do. Isolate the sick, quarantine their close contacts, close schools and universities, and socially distance for the rest of the population. The only strategy that was able to reduce and delay the number of new cases to a point where the hospitals and ICUs won't be overwhelmed was social distancing for the general population, not just the elderly or those at risk. Number 4, However, we know that voluntary social distancing measures are not working in Athens, as we've seen people continue to congregate in various public places. While younger people may be at lower risk, they will spread the illness to older and more vulnerable persons. Therefore, if people won't voluntarily socially isolate, we feel that mandatory social distancing must be implemented for the entire population, with travel limited to defined essential services. When in public, people must know that 6 feet of distance is required to be safe, plus avoiding surfaces and washing hands often. The city should also consider measures to sanitize surfaces to reduce viral load in public places. To paraphrase Dr. Anthony Fauci of NIH, if people accuse you of overreacting, then you're probably just barely doing enough. Let's make sure we do enough as a community. Now, in addition to the expert testimony that came to us tonight, I did want an opportunity for Manager Williams to briefly describe for us and for the greater public the modifications we're making in the administration and the messaging and the internal functioning of the Athens-Clarke County government in this time of emergency. So I'm going to ask Manager Williams to say a few words about that.
Thank you. And I'm going to give our public information staff a minute to pull up an org chart, organizational chart that will help me just briefly explain what we're talking about. But if the public's not aware, there is a National Incident Management System, or NIMS is the acronym for it. And in times of emergency response, our organization is set up for our daily routines and delivering services to our residents and our businesses. In this case, obviously, this is a very special circumstance that we're in. And so we are reorganizing so that we can have a streamlined response for both our internal workforce as well as the residents. And so I just wanted to share this with you, just at a high level, of course, working under the direction of the Mayor and Commission, myself and Captain J.W. Thaxton, who is with the Fire Department, is our Emergency Management Coordinator. In times when we're not dealing with disasters, our Emergency Management Coordinator is busy making sure that our departments and partners in the community are getting prepared for response. But when we kick into response mode, that responsibility changes and grows a great deal. And so we are working side by side, and he has created a policy group which involves a number of institutional partners, including the university and the school district, the city of Winterville and the hospitals and others. And we have periodic phone calls to make sure that each of our responses are being well coordinated. Of course, working with the Mayor and Commission as one elected body, we also have, being a county, constitutional and judicial officers. We work closely with them on their responses as well. And if need be, we can stand up a virtual emergency operations center. At this point, we are, as we are tonight, using technology to help have social distancing best practices, even as we coordinate large numbers of people in response. We are breaking up our response into 3 branches, headed up by the 2 assistant managers, Assistant Manager Lunnan and Edwards, and our PIO, Public Information Officer Jeff Montgomery, is our communications branch. And if you would, go to the next slide, please. Each of these branches have sections under them, and I know this is a lot. The point of this is to let you all know that we have been not only organizing our internal operations, but also galvanizing for response, because we do believe, as many have said tonight, that this is a long prospect for us, and the community needs the local government to set the example and to help guide and not duplicate, but augment and communicate, and that's what we're planning on doing. You can see some of the breakouts here. Mayor and Commission, I do intend to share a more detailed plan with you tomorrow. We are having daily calls with these groups to make sure that that we have objectives that are being defined and fulfilled. But under operations, as Assistant Manager London's heading up, this is where we will be concentrating on vulnerable populations and nonprofit support. I know this is yet to be discussed, but many of you have talked about an economic relief effort. And I think this group would be working with me through Assistant Manager London to help implement whatever form that should take with your discussion tonight. There's been a lot said about supporting our business, who is undoubtedly being impacted right now. And we want this community to be resilient. We want this community to return to its former glory in the wake of all this, and we're going to do everything we can to push those and push your initiatives forward. And I won't go through all of these, but understand that there is structure to this. I'd like the folks that are watching tonight to understand that your local government is in response mode, that we have some incredibly talented people that work for us. We also have some incredibly knowledgeable citizens, and we need to be able to harness those folks in the future as well. There'll be more detail on our response plan coming out, and I urge you to continue to go to our website. There's alerts that you can sign up for, and the mayor and commission have been consistent in asking us to push more and more information out to you so that you have a sense of what's going on.
Thank you, Manager Williams. I appreciate that. Any questions organizationally? Commissioner Neesmith first.
Oh, yes, I had proposed to Commissioner Edwards that because we're not epidemiologists, there's no epidemiologists in the room now, but this is not going to end soon, and things are going to be changing rapidly as we go forward. I want to be sure that we have a group of professionals, epidemiologists, ER doctors, whatever it is, who can keep an eye on the state of affairs in the health of the community and give us advice in a real-time manner and have the responsibility to do that. So I was proposing that we create an epidemiological advisory committee that had that job. They would meet when they felt that they should, and they would advise us, and then we would respond to their advice. Does this fulfill that idea?
No, sir, but we would be in communication with those folks. Up to this point, if you go back to the previous slide, please. The COVID-19 policy group does involve the health district and Dr. Stephen Goggins. We are also, the hospitals are participating on that too, and we are depending on those healthcare experts to be listening to those folks as well. But this would not.
I just have in mind.
Does not propose to be that type of group.
I'm just having in mind having a group, a small group of professionals, maybe it's 2 or 3 doctors and maybe an attorney who can be there during their discussions and be able to translate what they're asking us to do into the legal ordinances and policies that we would need to act on without the delay. And so they would be an official liaison between the hospitals and public health to us and shorten that communication cycle and have people that are specifically responsible for communicating with us and giving us real-time advice. Does that make sense?
Well, I think that type of knowledge base would be invaluable. I would say, though, that with the COVID-19 policy group, it is not merely health issues. In fact, coordinating our response and assistance to the school district in the distribution of food was important. So that policy group's working very well. I mean, I would love to be able to have routine access to a group like that to ask questions and learn more. I think it can only help.
Manager Williams, thinking about Commissioner Neesmith's prospect, I would pitch that perhaps in the next gathering of that consortium that we seek that kind of more focused, specific advisement. I have to imagine that they're seeking some of that, but given the thirst for information right now, I think we would all benefit from it.
Thank you, Mr. Mayor. I would feel much more comfortable going forward if we had that kind of advice. And we didn't have the opportunity to put a group like that together until now. And I think we would have benefited had we had that earlier on. I'm not being critical, not in the least. I'm just looking back and saying, what if we had had a group like this? We might have moved forward in a more positive way earlier.
I think I saw Commissioner Denson's hand as well.
Thank you, Mayor. Manager Williams, my only comment is on, and this looks great, but under the operations branch, I just would, and I'm sure this is already in context, this is already really happening, but I think it's important for us not just to think of it business support, but specifically workers and business support. Especially since when we look at the situation, many of the workers may no longer be actually attached to a business, and that's kind of the problem. So If we could even be using that verbiage a little bit more, just so that it's as we think about this, that's always in the forefront of our minds.
I appreciate that, Commissioner Denson, and certainly the recently unemployed would be what we would consider a vulnerable population, but one way or another, it fits, and we will be paying attention.
Any other questions from in the room before I turn to folks who are online? Commissioner Wright?
Are we at the point of speaking about the document at hand?
We'll get there in just a minute, but just wanted to see if you had any questions for Manager Williams simply about the reorganization pertinent to our emergency status.
Okay, I wanted to make sure I didn't miss that. No, I really appreciate that outline and that information. And if that and the PowerPoints that were presented earlier could end up with an online way for us to review them later, that'd be great.
Absolutely. Commissioner Link?
I was just going to repeat that and ask that those presentations be put online because the sound was pretty bad on our end. Sorry.
Definitely. We can put those presentations online for you and for the public. Absolutely. Commissioner Harrod?
I don't really have any questions about this per se. I mean, I think that as I've been suggesting, I think we need to have an economic plan in addition to a public health plan, and that needs to, cover the multitude of people that are going to be affected by this, not just businesses, but also the people that work for those businesses. And I think that's really important for the public to understand that. As several of you know, I've been a big proponent of us having an FAQ type thing on our website because I think the public has lots of questions about how we're going to get through this together. I think they have lots of questions about simply what the local government can and cannot do. We've heard questions about, well, can we simply move SPLOST money away from SPLOST projects and use that to provide income support? And obviously the answer to that question is no, legally and constitutionally we cannot. So, I think information is really important for the public to have, because with a void of correct information, all sorts of incorrect information will circulate.
No, I think that's right, Commissioner, and I think everybody in the room has on their mind simultaneously with the immediate emergency response, the simultaneous need for economic supports. Commissioner Edwards.
It all looks good at this point. I failed to mention earlier, the reason I'm not there tonight, everybody, I've been ordered to shelter. One of my best friends came down with the coronavirus and tested positive. So this is my last, I think Friday I can come off of isolation. So my friend's a general practitioner, a doctor here in Athens, Georgia. So just wanted to update the audience as to why I'm not participating in person tonight. Thank you.
Wishing you well, Commissioner. Commissioner Davenport.
Commissioner Edwards, did you say this Friday or next Friday?
This Friday, yep, just one more day, thankfully. And they said a very extremely low likelihood. Friday is the 14th day that I last had exposure to the person that they believe. The doctor has tested positive for coronavirus. The epidemiologist believes that he contracted the coronavirus from his daughter, and his daughter, but they're not sure. And his daughter was at my house 13 days ago. So one more day. Thanks for asking.
We wish you well, Commissioner. Be glad to have you back in action, live in person. All right, we're going to move on to the second order of business on our agenda. This is an ordinance to amend the code of Athens-Clarke County with respect to emergency management generally. So this is the underlying ordinance that would kick in anytime we have an emergency situation, not just now, but anytime in the future. And so if I could just ask Attorney Drake to discuss briefly kind of what the amendments are to this component that we're looking at first.
Be happy to, Mr. Mayor. The amendments start, first I'm going to say that some of the whereas provisions were fleshed out to reflect our authority to act hereunder, and as well as the information that's been conveyed tonight by some of our presenters as part of the work session. In addition, on page 3 of 11, you'll note a striking there midway through the page. Actually, I'll just go over the ones that have been made since what the commission has. Y'all know that one. If we'll turn to page 8 of 11. Well, it's 8 of 11 on mine, and I think on the mayor's. Let's see here. Yep. Should be 811 on yours. Item number, Roman numeral 8, number 9. Residential facilities, the language including hotels, motels, shared rental units, and similar facilities was added. And then on item number, Roman numeral, excuse me, I'm sorry, I read the wrong number, Roman numeral. That's number 19, that's 19, correct?
Attorney Drake, I was just referencing the underlying emergency ordinance, the prior document. I apologize.
I got ahead of us.
Again, this is our emergency management ordinance generally that, may come into play in the case of a tornado or other event.
On page 3 of 12, under grant of authority, you'll see where I added some language just to clarify further where the authority of the mayor and commission to act relative to declaring a local emergency comes from. And I to clarify that action will be taken via ordinance. On page 4 of 12, again, it just clarifies that we'll be acting via ordinance rather than a resolution. On page 5 of 12, it clarifies in section 3.343 and 345 that the manager or the mayor and commission have authority to act in hereunder. In those events where the mayor and commission have acted specifically via ordinance, that would preempt the manager. At page 7 of 12 just clarifies under the model declaration of local emergency the authority of the manager or the mayor and commission to act. It also reflects a change to the social distancing requirements, which are set forth under section 34-11. And those are the last changes. If you look at 34-11, I just clarified what social distancing measures are allowed, and also that's basically the change. And those things are social distancing measures, which may include but not be limited to curfew, shelter in place, prohibitions on limitations on the number of persons allowed to gather and or congregate in a public or private place. And finally, on page 12 of 12, it expands the definition for authorized and essential health care providers based upon some of the concerns that were expressed at the last meeting.
All right. Thank you, Attorney Drake. I appreciate it. Any questions of the attorney or questions about the document generally? Again, this is the underlying framework for any emergency situation. Commissioner Parker.
Thank you. On section, excuse me, give me a moment to find it. Section 11, I think it's on page 9. I'm really sorry, I just lost my place. There's a part where it discusses the manager's office making use of other entities were deemed necessary by the management to enforce compliance. I was wondering what other entities might be called upon to enforce compliance.
Code enforcement.
Code enforcement.
Yeah, this wouldn't be anything that you're not already aware of or anything we would create. It's just anything to gain compliance, building inspections, if it was something related to that, those types of things.
Could we possibly spell those out to make clear to folks, like, we're not calling the military, that, it's with things that are generally already within our powers to call upon for those purposes?
Go ahead.
I was going to defer to the attorney of existing ACC Gov staff or departments or, I mean, it could be the sheriff's office helps, but I'm not we don't have, even if you give me this authority, I can't mandate any external party to do anything.
Yeah.
But Judd, I'll defer to you, though, on the language.
Attorney Drake, could we add just parenthetically after that clause, such as unified government departments acting out of their normal purview?
I'm trying to figure out what section that's in.
And while you're looking, Attorney Drake, just to revisit this, because there's a lot going on, and I'm sure folks are a little confused. So what this particular ordinance, which is being revisited, it was presented as a draft model ordinance by the Association of County Commissioners of Georgia, which is sort of a professional association, if you will, for counties. It's a membership organization we belong to, as long as just about every county in Georgia. They have attorneys on staff, they have experts. They presented this ordinance a couple of years ago, and the attorney's office had brought it back forward. And what it's really meant to do is not unlike what the governor, with his declaration, in that it's supposed to streamline decision-making so that quick responses can be made in an emergency. Now, I will say, all of us, and in reading it, what we're typically used to here in Athens-Clarke County in Georgia are weather-related emergencies. So a lot of if you read it closely, what you'll see are things about evacuation, temporary housing. And if you think about what we're accustomed to with tornadoes and hurricanes, this is a different matter, a different crisis. And hence, I think the commissioner's deliberation over wanting to make sure that we've got it to where it gives us the appropriate authority to make streamlined decisions to be quick in our response.
Thank you for that. And I apologize a lot. I realized that the section that I was referring to is in item number 3, section 11 on page 9. So we can go ahead and come back to that once we get to the discussion of that matter, if that's okay.
Well, it's not in this document.
No, it's in the next
Oh,
one.
another document.
Okay.
Commissioner Neesmith?
Mr. Attorney, I can't find anything in this emergency plan that gives us the power to close a business.
Well, we have the authority,
We can implement social distancing measures, we can do a curfew, limit the number of persons allowed to gather in or congregate in a public or private place.
we have the authority under subsection I of section 345 to perform and exercise such other functions, powers, and duties as may be deemed necessary to promote and secure the safety and protection of the civilian population, including individuals with household pets and service animals prior to, during, and following a major disaster emergency. That's where that authority comes from.
Really?
Yes, sir.
It's not very explicit, is it?
In the previous segment.
I have a question real quick, please.
I'd like to get mine answered, Russell, if you don't mind.
Just a second, one at a time. Commissioner Edwards, I'll call on you in just a second. Commissioner Neesmith, did you have a follow-up?
Well, I still don't see it, Mr. Attorney. I don't see it. It said,
Well, we certainly can add that to the social distancing measures if we want to be, I think that's a good idea to further clarify.
And in that earlier clause regarding gathering in public and private places, if there's gathering that's limited, it could be conceptually limited down to 0.
But I don't have a problem at all with adding that in subsection 3-411A.
what happened to the discussion we had a few days ago about that we weren't allowed to interfere with a business by the state?
Well, I would say that my office provided a very detailed memo which addresses those issues, and I would defer to that memo which addressed that measure. Okay. The authority to do that.
Commissioner Edwards?
I would just like to point out that to my knowledge, nobody's talking about closing businesses. So, we can regulate the movement of people to manage a pandemic crisis, but we are not closing businesses. So, can we move on?
Well,
No.
we are under item number 3, closing non-essential businesses.
No, with all due respect, Attorney Drake, non-essential businesses are allowed to stay open to provide, excuse me one second, non-essential businesses are allowed to stay open to conduct minimum basic operations.
Well, I agree with that.
Which include bookkeeping? Which
I
include bookkeeping?
I don't disagree with that, sir.
Well, I'm sorry, but those operations are limited to things like bookkeeping and inventory keeping. They're closed. Customers can't come in.
Technically, according to the law, they are not closed.
Well, according to the law, they may not be closed, but if you're a shopkeeper, you're closed.
Actually, for example, I have a retail shop that I own with my wife on Broad Street. We've been closed since Friday. It's a non-essential business, but with the minimum basic operations, the owners would be able to go into the shop to perform the minimum necessary activities to facilitate employees of the business being able to continue to work remotely, to perform the minimum necessary activities to maintain the value of the business's inventory, ensure security, process payroll and employee benefits, and for related functions. So under that guidance, we plan on at some point, hopefully in the future, to visit our shop, just me or my wife, and take pictures of inventory and posting it on the internet. So minimum basic operations, that's not a closure of a business. We cannot do that according to the Georgia State Constitution that places strict limits on local government's authority to regulate private contracts. We cannot close down businesses. That takes the governor's action. You know, we're waiting on the governor to take action in this case, but he just released a statement today where he said he's leaving it up to local governments to act. And he encourages local governments to put down shelter-in-place regulations on their own, but he is not yet willing to put down a state decree to close businesses like what we've seen in Ohio, Illinois, California, where Republican governors have issued decrees closing restaurants and bars. That's not what we're doing here.
So
restaurants can stay open and provide to-go food, curbside pickup. So we're not closing businesses.
So obviously there's some difference in conceptual understanding of the language, and that's clear. I want to go ahead and move on to Commissioner Denson.
Thank you, Mayor. There was definitely, as we've talked about and Manager Williams brought up, there's definitely just a lot of confusion around some of this and therefore concern. So there was, and I was honestly just asking for clarification on this item because I received some concerned citizens' responses on, trying to see what item here it is. Under 342 Declaration of Local Emergency, on D1, C and D, there was some concern about the communication here that Emergency Management Director is authorized to execute a right of entry onto property for purposes of evaluating sites for emergency management functions and such like that. D touches on this a little bit also. And there was just some concern about seizure of property, those kind of things. And I think a lot of that was being read somewhat out of context, so I wonder if we could just have a little bit of clarification on that.
Manager Williams, I've been just given your experience here and in Floyd County. You might provide some of the kinds of examples where that emerges.
Thank you, Mayor, and thank you, Commissioner Denson. That is important. This is new language for people, and I can tell you, going back to what I mentioned earlier, these are really tailored more to what we are accustomed to in Georgia. Those are weather-related. I was a manager in Floyd County, and we had an F5 tornado come through there, and so you're at a point where, and there what we did is we used our building inspectors and tax assessors to try to. We have to very quickly assess the damage to report to the federal government in order to be eligible for those resources. And you can imagine, those are very small, localized areas most of the time. It's chaos. Sometimes structures are demolished. Nobody's around. We just need to walk out there and be able to tell what's going on. This is not meant as any type of, this health event, I really can't envision where that, if anything, we want to stay away from other people, right? So that's the type of language, that's what it was meant to do. I can assure you that we're going to be focused on the nature of this response, and we're not going to be trying to go beyond or exploit these powers at all.
Okay, yeah, I appreciate the explanation.
Commissioner Hamby? Sure.
I'd like to make a motion to approve the ordinance for the revisions to the emergency management plan.
I have a question about the document before we do anything.
Okay, all right. So we've got a motion from Commissioner Hamby, a second from Commissioner Edwards, question from Commissioner Harrod.
So I'm just looking through the document, and I mean, there's a lot in here, and it's complicated. And there's one bit, and I just want to clarify my understanding. So on page 7 of 11, under number 9, where we talk about educational institutions, and it says including public and private K through 12 schools, colleges, and universities.
I think he's on the wrong
I'm the wrong one.
You're on the wrong one.
What are we looking at then?
We're looking at the underlying emergency management ordinance. Item 2, that allows for emergency management operations in any situation.
Okay, so we haven't got to
No.
the second document, is that correct?
No. We'll be there in a couple minutes.
Sorry, it's with not being there, it's a bit, I'm trying to follow and the sound's not that great. So, okay, well, I will have a question about that later on.
Okay. All right. About document number 2, Commissioner Link, any questions?
Oh, no, I'm fine.
Commissioner Wright, any questions?
Sorry, I'm good.
Okay.
I'm here.
All right. With no further discussion.
I just
Commissioner
need,
Thornton?
I just need, did we clear up what? Why are you telling me to shush?
No, I didn't.
Okay. Did we get clarification on Commissioner Neesmith and Commissioner Edwards?
May I?
So follow-up question, Commissioner Neesmith.
I think that Commissioner Edwards and I agreed to disagree about the definition of closed. His definition is it isn't closed because the owners of the business can go to the business and do inventory and bookkeeping and set up an online store. My definition of closed is their customers can't come in. They're closed.
So is that also pertinent to business owners that provide service?
Depends on whether they're considered one of the essential businesses, so not in general, no.
So a barbershop would be closed?
Yes.
All right. Any additional questions about item 2? All right. All in favor?
Aye.
Any opposed? Any opposed to item 2? All right.
I am.
All right. For the record, Commissioner Thornton, Madam Clerk. All right. Moving on to item number 3. Item number 3 is an ordinance for the second declaration of a local state of emergency related to COVID-19. Obviously, the public has a draft, but draft has been amended and updated. I want to highlight a few items for everybody in the room and everybody in the public that are in the document. On page 4 of 11, this does declare that all individuals currently living within the territorial limits of the unified government of Athens-Clarke County shall shelter at their place of residence. So there's clarity there that this is comprehensive for everybody here. There are some definitions that are very important. And so looking on page 5 of 11, Under definitions and exemptions, it notes that for purpose of this order, individuals may leave their residence to perform any of the following essential activities, but people at high risk of severe illness from COVID-19 and people who are sick are urged to stay in their residence to the extent possible, except as necessary to seek medical care. And those activities include engaging in things such as tasks essential to health and safety, including for family and household members and pets, including obtaining medical supplies and medication, visiting a healthcare professional, or obtaining supplies necessary for working from home. It also includes necessary services or supplies for themselves and their family or household members, or delivery of those services or supplies to others, such as, by way of example, canned food, dry goods, fresh fruit and vegetables, pet supplies, fresh meats, fish, poultry, and any other household consumer products and products necessary to maintain the safety, sanitation, and essential operation of residence. It also calls out engagement in outdoor activity, provided the individuals comply with social distancing as defined in the section, such as, by way of example, but without limitation, walking, hiking, running, or bicycling, and providing essential products and services or caring for a family member or pet. Also, for the purposes of this order, individuals may leave their residence to work for or obtain services at any healthcare operation with broad definition defined herein. Also, this is on page 6 of 11C. For purposes of this order, individuals may leave their residence to provide any services or perform work necessary to the operation and maintenance of essential infrastructure. This is including but not limited to public works construction, and all related services, in particular for affordable housing, for individuals experiencing homelessness or otherwise, airport operations, water, sewer, gas, electrical, oil refining, roads and highway work, public transportation, solid waste collection, removal, internet and telecommunication systems, including the provision of essential global, national, and local infrastructure for computing services, business infrastructure, communications, or web-based services. It notes emergency responders are all exempt. Toward the bottom of the page, item F, it notes healthcare operations and essential infrastructure for healthcare operations are essential businesses. Going on to page 7, it notes that items such as grocery stores, farmers markets, farm or produce stands, supermarkets, food banks, and so on are all essential. Also, food cultivation, including farming, livestock, and fishing, and also businesses that provide food, shelter, or social services, newspapers, television, radio, and media, gas stations, auto supply, auto repair, banks and related financial institutions, hardware stores, plumbers, electricians, and other tradespeople, businesses providing mailing and shipping services. It notes educational institutions for purposes of facilitating distance learning or performing essential functions. It notes dry cleaners, laundromats, and laundry service providers. Toward the bottom of page 7, it notes that restaurants and other facilities that prepare and serve food, but only for delivery and carryout, are allowed. Goes on to note that schools and other entities that typically provide free food services to students or members of the public may continue to do so under this order, under the condition that the food is provided to students or members of the public for takeaway. Further notes that schools and other entities that provide food services under this exemption shall not permit the food to be eaten at the site where it's provided or at a gathering space. On the bottom of the page, it outlines that this includes businesses that supply products needed for people to work from home. Beginning of page 8, for businesses or manufacturers. Moving on, it includes home-based care. It includes residential facilities, specifically including hotels, motels, shared rental units, and similar facilities or shelters. Professional services such as legal, accounting services, and real estate services. Also includes, unless otherwise preempted by state law, child care facilities, providing that those are in stable groups of 12 or fewer, meaning that the same 12 children gather daily. It notes that all businesses which possess a Class A retail liquor package license, Class B retail beer package license, or Class C retail wine package license shall be authorized via drive-through or in the parking lot or at the curb. It goes on to note a number of minimum basic operations, sort of reflecting some of the conversation earlier, in the next several sections on pages 8 and 9. Toward the bottom of page 9, it notes for the purposes of this order, social distancing requirements include maintaining at least a 6-foot social distance from other individuals, washing hands with soap and water for at least 20 seconds as frequently as possible, or using hand sanitizer, covering coughs or sneezes, and regularly cleaning high-touch surfaces. And then maybe most importantly for our conversation tonight, especially given a lot of the public input that we received, conversation on Monday and conversations that we as elected officials have had, there's an enforcement and remedies section. And I'm going to pause for a second to note that I think it's the clear intent of everybody in the unified government, both the 11 elected officials in the room, of management and staff, that we provide as much support as possible to the public. And this makes that explicit by noting that we are not going to be using police powers, handcuffing, putting people in cars, putting people in jail, or similar mechanisms for individual interaction. And so I'm going to read this. This is the enforcement and remedies section. And it has 3 sections. The first is around individuals. It notes that in recognition that the unified government does not have the personnel or resources to monitor and police distancing or gathering limitations or shelter-in-place requirements for all individuals currently living within the territorial limits of the unified government of Athens-Clarke County, Georgia, the Athens-Clarke County Police Department, and others deemed necessary by the manager under this declaration, are authorized to provide support compliance with this order through information delivery and education of individuals regarding the imminent threat to public health posed by COVID-19. Again, our support of individuals, whether singles, small groups, individual members of the public, is to provide information and guidance. Again, not arrest, not citation, not jailing, nothing of the like. On page 10, it does go on to note in B, with regard to covered businesses, any violations of this order by covered businesses shall be considered ordinance violations subject to the general penalty provisions outlined in section 1-1-5 of the official code of Athens-Clarke County. I'm going to stop for a moment simply to note that it's always the case if a business is non-compliant with an ordinance, they may be fined or closed. And so that continues to be the case. So should an entertainment venue be non-compliant and there are people gathering there, we're able to shut that establishment for the health and safety of everyone. Finally, Chapter C regards individuals experiencing homelessness. This notes that the mayor and commission direct the manager to engage with service providers to ensure there's ample capacity to provide shelter to all homeless individuals in the territorial limits of the unified government of Athens-Clarke County, Georgia, while using social distancing requirements. And we empower the manager to utilize the facilities and resources of the unified government to accomplish this directive. We move on to a further directive. The mayor and commission hereby direct the manager of the unified government of Athens-Clarke County to return to the mayor and commission by no later than Friday, March 27th, 2020, giving a report setting forth fiscal support recommendations for residents, including modifications to the unified government's fines, fees, and charges. As noted earlier, as we're working simultaneously on healthcare and crisis management, we're considering economic support opportunities, and that directs the manager to provide some of those to us by next Friday. It also says that to the extent reasonably possible, the Athens-Clarke County Unified Government hereby directs the manager to immediately deploy temporary hand washing stations countywide to arrest the spread of the coronavirus. And then there's an amendment that I know was discussed and circulated with authorship by Commissioner Denson that's attached that, if you desire, could be endorsed in whole adoption of this ordinance. I'm going to turn it over to Commissioner Denson just to describe that briefly.
Thank you, Mayor Gertz. Yeah, as we did talk about that, about needing to have this more holistic approach so that we are taking care of the financial well-being of Athenians and workers and our local businesses especially. There's language here that I would recommend to be added in as section 13 that we can move down. and it has 3 elements to it, and I'll go ahead and just read. The Commission of the Unified Government of Athens-Clarke County orders the manager of the Unified Government of Athens-Clarke County to allocate up to $3 million in funds by transferring funds reserved for the Prosperity Package for the purpose of providing emergency assistance to those affected by the COVID-19 pandemic. The total funds may be utilized as follows: $1 million to assist county partners with providing emergency assistance to residents of Athens-Clarke County who are employees and hourly wage earners of businesses operating within the boundaries of Athens-Clarke County whose incomes are adversely impacted. $1 million to support small business continuity, and $1 million to provide assistance to nonprofit community partners who are providing essential services with the response to the COVID-19 pandemic. And I would add the same language onto the end of these. Also, on the next part of it does go into saying that the Unified Government of Athens-Clarke County shall seek reimbursement from the state of Georgia and from federal emergency funds for all eligible expenditures, and that the Unified Government of Athens-Clarke County shall pursue further ways within the FY 2021 budget to give relief to Athens residents during the COVID-19 pandemic. And I would put the same clause that is currently on number 14, asking that, hold on, not 14.
12.
12. Asking, that this be, that this plan be presented no later than Friday, March 27th, 2020, and reported back to the mayor and commission.
Okay.
And I guess I will just put on there that I think this is extremely important. I think we all are very aware that the financial repercussions that will come because of these completely necessary changes that were taking place. But therefore, I think it's important that we immediately, as soon as possible, which is now, start taking measures to heal those wounds that be caused by this.
All right, so everybody's seen the document in its entirety and kind of have the summary here tonight. First, Commissioner Hamby.
Sure. And I would be fine with this. I would suggest, though, that perhaps instead of assigning, I'm fine with the Prosperity $3 million. I would probably add $3 million in additional resources as needed, so that it doesn't just limit. So that folks know if we need to do something additional, then let's do something additional at the end of the day. So don't just don't limit the manager to that component of it. He may come back with some recommendations that may be a little bit more for us to do. I would also suggest, instead of limiting, I don't mind the categories that you put there, but maybe not put the dollar amount, because one category may be
more significant.
More significant, or we may find that there's more of a need for one particular category over another. So.
And the last sentence does say, though the total funds may be transferred to assist with any of these efforts without specific limitations. So that,
Oh, you do have that? Oh, okay. All right, but if y'all would agree to the prosperity money and any additional resources that may be necessary.
I'm completely happy.
And I'm glad I'm glad we're looking at this, y'all. This is certainly they go hand in hand. We've obviously see it when we're going through the community and seeing the businesses that aren't doing the business, and that's important for people in our community who are living day to day and week by week to earn a paycheck, and they need those businesses to survive. And so it's good that we're looking at both the health crisis that we're facing as a community, and also recognizing that it's also an economic crisis that we're facing as a community, and it's good that this body's looking at both hand in hand so that we can do something about it.
Thank you, Commissioner. Commissioner Thornton.
I also am in agreement 100%. I do hope, since we've already invested money in the neighborhood leaders, as we start reaching out to figure out who needs these resources to help them, we should utilize them to help identify these businesses or individuals that need that needs their service. I think this really kind of streamlined their goals and objectives. I've had some concerns, but I think this is much more focused, and they're on staff, they're already there, but they may need help, Mr. Williams, in developing a plan to execute this.
Commissioner Hamby?
Mr. Mayor?
Go ahead, Commissioner Harrod.
Thank you. I didn't get the attachment until just a few minutes ago. I don't know what's happening with our email and everything. And I gave it a quick look. I definitely think that we should be using the prosperity package money that we had talked about. And, I've been arguing that we should, at least for the last week, that we should be doing that. I think it's really important that we provide some kind of economic help to both businesses and their employees. I tend to agree with Commissioner Hamby that I think maybe at this precise moment in time, not putting in specific amounts might give us a little bit more flexibility. I completely agree with sections 2 and sections 3 as Commissioner Denson has just read them. But I don't see this as being the only thing. I mean, I think I like that this is, we're going to get a response from the manager by a week tomorrow, and on what we can and cannot do to get us through this crisis. But I hope that we may be creative in some other manners as well that are fiscally responsible on the one hand, but that we also really help people who are going to be hurting significantly. So I hope, and I don't think anybody's saying this, but I hope we're not just looking at the $3 million it is in the prosperity package, but that there are also some other things that we could put our creativities towards to really try to serve the residents of the county.
I hope when the history of this time is written about Athens, people are able to say the commission took decisive action, but it was not limited to one night, and I think that's definitely going to be true. Before I return to Commissioner Hamby, any other input?
Yeah.
Commissioner Link?
Yeah. First of all, I want to thank Commissioner Denson for bringing up the need to get those fiscal issues on the table right here at the front end. I mean, supposedly we're going to see some federal and some state relief, but we know how that bureaucracy works. So the sooner we can get some relief to our local folks, the better. The economic impact is going to be devastating. It's going to trickle down to all segments of our community and beyond. And I want to encourage folks, there are those of us who are able to work from home and are still drawing a paycheck. So anybody out there who is still doing fine, do whatever you can to patronize these businesses. And I encourage businesses to do GoFundMe pages or whatever they can to get some revenue coming in and make sure it gets to those folks who are working very few hours or not at all. I do have there's one little language tweak I'd like to add to the ordinance under the definitions. Definitions and exemptions. It's A1. We're talking about the I guess it is, to engage in activities or perform tasks essential to their health and safety or to the health and safety of their family or household members. I'd like to word that family, partners, and significant others or household members. Definition of family these days is very broad. We have families that exist in multiple households where children are shared custody of children, and partners that may not be married but they have double households. I think we just need to make sure that those are covered, and if we could add that small language in there to assure that those families and those family units are protected in this ordinance.
So that would be safety of their family or household members or partners.
Yeah, I'd like to say family, partners, significant others, or household members.
Or partners, significant others is also in that litany.
Yeah.
Second.
Let's just keep that as an amendment before we get to making a motion to approve, if we don't mind.
All right. Other input, I see Commissioner Wright and then Commissioner Parker, a couple others. Commissioner Wright next.
Thank you. I agree with the direction everything's going. I really appreciate everybody's work and us being able to jump ahead and include, so we talk to people in the community about the financial assistance. I thought that we had enough going on, and it's impressive that we can go ahead and add that in at this time and be ready maybe to do another work session type information meeting like this for the community on that topic. And I support what we're doing.
Thanks, Commissioner. Commissioner Parker?
Thank you, Mr. Mayor. I just wanted to come back to the comment I had made earlier when I was erroneously looking at the different document. On section 11 on page 9 in item number 3, specifying which departments could be deemed necessary by management for enforcing compliance. I would really appreciate if that was added here. Otherwise, I'm really happy with the additions that we have here regarding spelling out what the role of our police officers will be during this time. I got a lot of concerns from folks about the interactions that would be possible between them and vulnerable populations, particularly our homeless community, as well as communities of color that have higher rates of unpleasant encounters with our police as is. So I'm happy to hear that there'll be more of a supportive and educational presence rather than a punitive one. I did have one question regarding essential businesses, particularly businesses or manufacturers that supply other essential businesses with the support and supplies necessary to operate. I, for example, got an email from an individual that operates a business in my district where they create geotextiles, which are necessary for creation of drainage products. That to me sounded like a business that supplies something essential to the operation of another essential business, but the definition of that is really broad for some, and I was wondering if we could give some examples of what other businesses might be that provide some of those essential supplies that will be necessary during this time.
Commissioner Parker, point me to the page. I apologize.
Sure, yeah, so give me just 1 minute to pull it up.
It's on the number, Roman numeral number 15 on top of page 8 of 11.
Yeah. Businesses or manufacturers that supply other essential businesses with the support or supplies necessary to operate.
I guess I would loosely term those as wholesalers or the like.
Okay.
Attorney Drake, is that your reading?
Yeah, that would be correct.
Well, it explicitly says manufacturers.
Businesses or manufacturers?
Yeah.
It says that.
Okay. I appreciate that
Okay.
clarification. With that said, I'm really glad that we're taking a swift approach to making sure the workers of our community are looked after. And yeah, I'm happy to support moving ahead with the reallocation of those prosperity package funds tonight as well.
Thank you, Commissioner. Commissioner Neesmith.
Yeah, I fully support Tim's idea. I think it's a great use of funds. It's not going to go very far, unfortunately, but we're doing what we can. I wanted to point out that, because I had some questions from a constituent, that one of the essential businesses is businesses that ship or deliver groceries, food goods, or services directly to a residence. That will include domestic workers. So that means that our
Cleaning.
Yeah, our cooks, our house cleaners, whatever, are still in business. I wonder, are we covering government meetings here? Will this meeting be illegal tomorrow? I didn't see that anywhere.
I believe government operations is one of the
Just
called out
government operations,
activities.
okay, I saw that. And I noticed that, or I heard that we had closed down our building inspections. Is that true?
Manager Williams, can you talk about kind of this week versus next, just in this interim period?
Yes, thank you, Commissioner. And this is on the website, but I'll certainly forward out to everybody an update on, it's a daily update on the operations that we have. And so we did take some steps on Monday to close workstations We had worked over the weekend and going back into last week on a reduced services model where we were promoting the safety of our workforce, but at the same time providing some public services. It was a great effort. We've got some good plans in place. Based on the conversation on Monday night and some other health-related factors, decided to close workstations again Wednesday through the end of Saturday, which is the end of the payroll period. That being said, we had already put into place a good number of teleworking agreements with our folks. So while folks are at home, they should be working. We also are taking advantage of technology, and I want to give our information technology interim director Travis Cooper and his staff kudos. We're using an application called Jabber to forward phone calls to folks at home so that they can take the calls and be there. I appreciate everybody's patience. We're still getting that deployed, and some folks today may have not gotten an answer when they wanted to. We're talking about coming back with some heightened services next week. Certainly not back to normal. We're promoting social distancing in the workplace and on the job site. So there's more to come there, but we'll give you some information. And let me get to your question. Sorry about all that, but I want to give everybody the background. The building inspectors felt very strongly that they needed to be out making sure that commerce was being conducted, that in a safe manner, projects could be moved on, that certificates of occupancy could be provided. We understand that whether it's houses or renovations or building construction sites, that people have money in play, and it's important to the future and the workers of Athens-Clarke County. And so they have been out there, and if anybody needs, and Commissioner Hamby can attest to this because we spoke about this yesterday, if you have any special needs, just let me know and we'll make sure we'll take care of it. With the permits, that has been placed on hold just this week, but we're going to get that back up and running next week.
Okay. So that would imply that construction is also an essential business. People can report to work to build their houses. And
Yes, yeah, construction broadly is called out.
all right. And our parks and trails are closed. Is that right?
Yes, and that does have, and we're going to be looking at that for next week. But when there was passed less than 10 on public space, that made us relook at our parks. And certainly, I think with what you're proposing to, I think we can work with the language that's being proposed. You're on the cusp of approving, especially having talked very closely with our police chief on the education standpoint. This would be a much better, say that we've got some folks, you've got close to 10 folks, then our officers will pull up and use a loudspeaker to just say, please, and educate the folks, you need for your own health purposes, please disperse, go home, that type of thing. So I think we'll be able to get those. I've read the hundreds of comments that have come in today along with y'all. I understand that personally, I feel the need to go out and recreate just to clear my head, and if that can be done in safe and social distancing. So we'll be working with leisure services staff to see what we can do about that.
Attorney Drake?
Yeah, I just want to point out for Commissioner Neesmith, also with respect to his concern that he spoke earlier, item number 9, Roman numeral number 14. On page 711, I'm not great at Roman numerals. After hardware stores, is that 19? Plumbers, electricians, exterminators, and other service providers who provide services that are necessary to maintain the safety, sanitation, and essential operations of residences, essential activities, and essential businesses.
Yeah, it's 9, but yeah.
9.
Yeah.
That's 9, yeah.
X minus 1. 10 minus 1.
That also fits very well to your concern stated.
Okay.
Probably better.
So can I go on just a little bit more?
Yeah,
Is the animal shelter open?
Yes, thank you, Commissioner. No, it is, and I've seen comments along those lines. The Animal Services Department is considered an essential and to some degree a public safety service.
Okay.
What we are limiting is outside access into the shelter. Folks are there, in normal working hours. We are arranging by appointment only. We can meet folks outside, or we can use some of the community areas outside for them to visit with dogs. We've got an active fostering program, Assistant Manager Edwards and our Geospatial Information Officer have put together a daily update, twice daily update on that we plan to share with you along with some other data in the community so they can understand what's going on and not feel like they don't know.
Okay. So just to go back a bit, our greenway trails you anticipate will be open with distancing, social distancing requirements?
Yes. What we're trying not to do is, let me consult with, that would be my understanding.
Okay, so you're trying to. That's
We're
good.
trying to, and, you know, the public buildings associated with the parks are obviously closed, and not wanting to invite, you know, pickup games where more than 10 folks could be together. We're trying to discourage those types of things.
And that would be an odd-sized ball team of any kind. We haven't addressed call centers, and I think we've all gotten an email or three about the situation in a call center, which is lots of people in a room, elbow to elbow, talking, which is probably the worst epidemiological environment you could come up with other than, well, that's pretty much it, sitting next to each other talking. Does this address, where does that fall in here, Mr. Attorney? Are they exempt, or are they going to be closed, or what is it? Can you address that, or have we done it?
Give me a minute to study.
Okay, we can get back to that. I remain, I mean, I've had so many phone calls and had so many meetings the last couple of days. I know you all have, and, you know, one of the biggest concerns I hear from some of my constituents, other than the fact that, well, that we're closing them or causing them to really reduce their ability to keep their employees and use the cash register, is whether or not this is constitutional, whether or not we have the right to close a business. And I don't know, I'm not a constitutional attorney, and I can't decide, and I can't make a decision based on something I don't understand. But it's a big concern under a lot of members of the community, even though we know we have to do some pretty drastic things in order to protect our public. I'm concerned about that.
Commissioner Thornton?
I'm also concerned, I'm sitting here getting texts now about small business. So if this goes into effect tomorrow, how does the local barber or the local beautician or nail person get the news tonight for tomorrow? Now, personally, I think barbering is very essential, but I know that's not on the list. So how are people getting this news by tomorrow?
Certainly, this would go into effect 12:01 tonight. I've been working with public information to get out our official action. Anticipate upon the conclusion of this meeting that same action happening. Clearly, earlier we heard conversation about the FAQ kind of document regarding this action. That is important. I'm happy to sit down after this meeting and work on that. Manager Williams.
One thing we could certainly do is those that have filed their occupational tax certificate, if we've got email on file, we can certainly generate a message to them. So we do have a listing of businesses that have paid that tax in Athens-Clarke County. I cannot say if we have emails addresses for each one.
Attorney Drake.
Yeah, Commissioner Neesmith, with respect to call centers, 15 says businesses or manufacturers that supply other essential businesses with support or supplies necessary to operate. So to the extent the call center was performing in that capacity, that they could remain open. They would, however, have to, as all the other businesses, essential businesses, have to observe social distancing.
So we've got to do the social distancing.
Right.
Okay.
And I guess that has been what I've been trying to get to. I think if businesses knew that this was like on the cusp about to happen, you know, they may have had a plan to do social distancing. Now, I hope that next week, County Manager, that we do give people an opportunity to talk about what they can do to create a healthy work environment. That's the part that I think I'm having problems with. Some folk are already doing some things, some folk don't even know this is going on, and they may already have a plan on how they can minimize the 10 people, still may lose money, but could still maintain their job. I think we just, and I've talked to several commissioners, and they said that we don't have that kind of time with the spread of everything. But I just want to go on record that I'm probably going to vote for this, but I'm really concerned that some people will do the right thing if we just ask them, and we just haven't had time to do that.
Commissioner Hamby?
Thank you, Mayor. I think what we're doing here tonight, like I said, addresses the economic side and the health side. I know we spent a lot of time Monday night. We can spend a lot of time tonight going through this and talking about the exemptions or non-essential versus essential and such as that. But at the end of the day, you look around what's going on in this country and in the world and see what's happening with this. I said it on a radio show the other day. I'd kind of rather be accused and criticized of overreacting than not doing enough, sort of like what those doctors asked us to do. So with that said, I think I'd like to go ahead and make a motion to approve this. And
I second.
With Mariah's change?
I'm sorry, I was about to say with
mine and Melissa's and Commissioner Link's changes?
right, with the three changes, Commissioner Parker, Commissioner Link, and Commissioner Denson's amendment about the economic policies to have the manager send something to us on next Friday. So with those three additional things, and
Before we vote, I'd like to bring something up.
Commissioner Hare?
Can you hear me?
Yes.
Sorry, I'm just trying to get my computer to work here. So one thing that and I'm fine with almost everything that's in here. One thing that I would like us to perhaps think about, though, or at least to have some further discussion, and I'd like to see the opinion of the attorney. We seem to be telling various other governmental entities, such as state level entity and the local board of education, especially where we talk about educational institutions, including public and private K through 12 schools, colleges, and universities, what they can and cannot do. And I'm not sure that we legally have the authority to do that. So would it make sense to just simply strike the two words public and just leave it at private, or what's the attorney's opinion?
Attorney Drake?
I think, I don't disagree, as we were just communicating. I think that because the governor now has specifically acted to close all public schools, and the Board of Regents has acted with respect to universities and universities. I think we could do that one of two ways, just say unless otherwise preempted, add that at the beginning of Roman numeral number 11. We did that down below for the child care facilities because we weren't sure, but I think definitely we are preempted there. It's because they've already taken the actions, but I think we could either, I really think I'm fine with your change, just to strike public and there.
All right, so
And does that, just so I'm clear, does that still retain the intent of what we're trying to do?
Oh, yeah, that does not affect it. I mean, as a practical matter, we had talked about it, we realized that we've been preempted, and
okay.
So I think that's appropriate.
Well, as I say, we need to work with our partners locally and at the state level, and I don't want us to overstep our bounds in that regard.
I think I would prefer just to say unless otherwise preempted, if it's okay.
I have a couple
Is
things.
that okay, Commissioner?
I'm sorry?
Is it okay if we just said unless otherwise preempted at the beginning?
I'll let you go.
Well, what do other people think? I mean, I'm fine with that if that achieves what we're trying to do. It basically says, we need to stay in our lane and
Right.
not get in their lane.
I agree.
I agree.
All right, unless otherwise preempted, is inserted, if it's okay with the motioner and the second.
I have a couple things to add just comments.
I know Commissioner Davenport hadn't commented. I apologize. I wanted to get to him.
So I just want to keep people in mind, there are like big businesses that are operating in Athens that where employees, are a little hesitant to go to work because of some of these big employers are not participating actively in social distancing. So I just want to make people aware of that. And, that there were businesses that are essentially by 12:01 tonight will be shut down that were actively participating in social distancing that, I think that should be open tomorrow because, they were doing their due diligence on their own. But I just want clarity for, just to make sure that businesses, even though the activities are the definition of some of what these businesses are doing, that business also implies to nonprofits as well?
I believe nonprofits are specifically called out in the text. Commissioner Thornton?
I'm still struggling about tomorrow for some folk. But I do support, I understand why we're here and why we're even gone this far. It wasn't funny to me, but I saw a mother with the mask on at Kroger, and her son is running all around just free as a bird. I don't think people get it, and I know we got to do something everybody doesn't get it. Manager Williams, I just want you to take a note for me, because this is really hard for me. I want to suggest and support the financial support for small businesses almost immediately, whatever that's going to look like. I would like for you to look at and consider incomes for renters and low-income homeowners. I mentioned to Commissioner Denson, we have encampments. Maybe we could look into porta potties and sanitizing spots where we know we have encampments. I would like for you to get with funeral directors to find out how that industry can address deaths in the family and how that should be handled. I do not want to put a total burden on the police department. I think we should look at other entities like code enforcement and working with UGA. And I would like for us to be aware that this social distancing could be very harmful for families of domestic violence. And I would like for us to see how we could use telehealth services for folk that has that insurance or capabilities. And also that all of our information is put out in Spanish for our Latino community. I do want to thank everyone for working really hard to address the homeless issues. This is new for everybody. Everybody knows I do not support mandatory anything, but given the conditions and given what we've heard, I know what I need to do, but we need to make sure we're doing everything to minimize some of this setback. And we'll get through it. We'll get through it.
Commissioner Link?
Yeah, first of all, I want to thank the chief for being present and addressing, being available. I had a really good conversation with him, and I feel good about, the intentions of our officers as vehicles for communication. I think that, this mandatory ordinance is necessary to send the very, very, very strong message that this is a public health crisis. It's a pandemic. Everyone is in danger and people are dying. We have 8 cases now here in Clarke County. There's probably a couple hundred out there that we don't know about. Our public health officials said, we just started testing. I spent, a lot of the last couple days on the phone with assorted public health officials, and we had a Board of Health teleconference meeting last night to get this information. And you know, my main concern is that education, getting that education out there. I did a lot of looking around the internet to see what other cities are doing, and you know, talked with our local officials on, you know, how we can learn from the other communities. And we did talk about how to get this information to our manufacturers, our telecommunications, developing those kind of targeted industry-specific materials, because yeah, the CDC has guidelines, but they're not presenting them to each and every business, and those guidelines are buried in like white paper documents. So I think that's something that we can communicate with the public health department, continue to make, reach out to the Chamber of Commerce, get a list of our manufacturers and businesses where people might, you know, still be operating in close quarters, our factories. I am hearing folks who do work in our factories and they don't feel safe. So if in the next 24 hours, if we can develop some protocols to get this information out, it's essential. People are going to work factory floor with 1,000 other people, taking it back to their community. I also feel like we need a hotline, and a text hotline, so people can report places where it's evident that folks are not getting the message. So we can get that information to those places and to those people. So, you know, I really think that, you know, we can't just pass this ordinance and presume that everything's, you know, everybody's going to fall in line. We need to really, really, really focus on education. And the sooner we can get those materials to the right places, the better. And it's going to involve, you know, our Chamber of Commerce, our non-school district, and the general community. I mean, we are getting emails from people who are reporting unsafe actions, but I think there needs to be a really focused.
Thank you, Commissioner. Before I turn back to the room, wanted to check to see any other comments from folks online. Commissioner Edwards?
I have one more comment. I'm sorry.
Go ahead, Commissioner Link.
Yeah, I wanted to add that, you know, as much as we're doing, it's not going to be really impactful unless we get our surrounding community on board. You know, if someone wants to go out right now, they can just go out to Epps Road and sit down, you know, at the Cracker Barrel. I have heard from folks who work in some of those businesses who are still going to work and they're scared. They're, you know, they're under the same roof, hundreds of shoppers and diners, and you know, what we're hearing across the nation is these regional efforts. So I'm hoping that we'll make a real concerted effort to reach out to the surrounding counties and assure that they're undertaking some of these measures as well.
Thank you, Commissioner. Commissioner Davenport?
Yes, just one quick, and I hate being that stick in the mud, just making sure that our language, because right now we're using the word shelter, shall shelter in place, like as our model for our residents, that that DPH also follows that model, so that the language can be consistent when people see it in public. Instead of saying stay at home or quarantine, we just use that same language as shelter in place. That make any sense? Okay.
Absolutely. Yeah, no, and I think both your comment and Commissioner Link's reflect a regionalism that's necessary. You know, we're not an island, though we feel like it occasionally. You know, people don't recognize the jurisdictional boundaries as boundaries. People move around. So I pledge to reach out to our neighboring folks. Commissioner Harrod?
Yeah, I just wanted to go back to the issue of our state and local partners at the moment. I mean, there are a lot of people that work both for the school district, but also, you know, for our public colleges, UGA, Athens Tech, and others. And it seems to me that we would be trying to suggest to them that, you know, that we can tell them whether or not their employees can come to work. And legally, I just don't think we have that authority. And so I think that they're certainly encouraging their employees to practice social distancing, but there are a lot of employees, often part-time, that work in those institutions, and legally, I don't think we can tell them that. I don't think we can tell Athens Tech, UGA, the Board of Education that we are not going to allow their employees to come to work. I think that has to be a decision to be made by them.
Attorney Drake, concerning Commissioner Harrod's questions, when I look on page 9, travel related to essential government functions, would employment at a public institution be included in that?
Yes, and I think, again, to clarify, the Commissioner, I don't disagree, and I think unless otherwise preempted, I think we are preempted there with respect to those entities, and especially, so I think we're good, but if you would like to make another change, I'm willing to make it. I don't disagree with you.
Well, I mean, is it maybe cleanest just to exempt those entities?
Yeah, we could just,
If we just struck the word "and public" from the earlier
we can do
element.
that.
Could I say something real quick, Mayor? Sorry.
Yes, Commissioner.
I'm not seeing where we're telling them not to have their employees come in. The only thing that would apply to them would be what applies to everybody, that they must practice social distancing. So I think we're good.
But I actually think, though, now, I think if the governor has acted with respect to public educational institutions, I think the Board of Regents we probably have an issue. I don't, and they have, so it's happening regardless. So I think we should, I don't disagree with the Commissioner Harrod's statement, so I think we ought to just strike public.
Strike public from the educational institution paragraph.
We don't have that authority.
And certainly, I know it's long been the case that over matters like planning, zoning, land use, and other issues related to that, we don't have sway over any other local governmental entity such as a school district, nor over a state institution. So I anticipate that the same would apply here. Commissioner Denson.
Thank you, Mayor. Two things. One, it was a question I got from some individuals with, especially some of the students moving out since the semester's over for them, and also just residents within our community. There was some concern about being able to have moving services and being able to travel via need for literally changing your residence back and forth. That was a question I got, so I'll throw that over to the attorney. And I had one more item too. I don't know if we feel like that's covered here or.
Where somebody had a moving service to move?
Using a moving service to move, or they're moving themselves back and forth between their former and then future residences.
Would travel to or return to a place of residence be included there on page 9?
I got a question today from a sorority chapter, the national, wanting to know if they had a problem with their folks coming back to the dorm or the sorority house and picking up their stuff and taking it home. My interpretation was both of those are residences, and so there's no problem.
Okay, as long as we just want to make sure we had that okay. And then the one other thing I had was, and this is something.
So we also have travel to or from educational institutions, persons receiving materials for distance learning, for receiving meals and other related services.
To come back to school.
Travel to return to a place of residence from outside the jurisdiction, so that's what they would be
They were
basically
covered.
doing.
Okay.
Yeah, coming back to get
The other item was, and this is something that Lawrenceville and a few other cities have done too, to try to, again, help out the restaurants, since many of them have sales, a lot of their sales and revenues through alcohol sales. If we could, if possible, I guess it's on 22, I think. After the childcare, all businesses which possess a Class A retail like, basically letting people have, do drive-through or pick up and take home. I'm wondering if we could allow that to have closed container beer and wine sales from our restaurants so that they could clear their stock that they have sitting there, if that could be included.
We researched that today at the request of Commissioner Harrod, and we believe there is a state law that specifically preempts our ability to do that. I am aware that another jurisdiction in Georgia has done that, but I think they're preempted.
Okay.
Perhaps, but there's a state statute right on point. I could send it to you tomorrow morning.
Commissioner Thornton?
I just have two questions. County Manager Williams, is there, I'm just sitting here getting texts. I'm not even going to try to ask you all these questions, but can we put in a hotline almost immediately so people can call with the questions that I'm seeing on that I'm getting? I'm like tomorrow. Can we come up with an 800 hotline or something?
I'm not sure we can do that tomorrow, Commissioner Thornton, but, I mean, we can look at trying to have a resource to, I don't know the nature of the questions that you're getting. I understand.
It's everything.
Everything, yeah.
And my next question is, when we're talking about manufacturers like Caterpillar, and we're coming up with the social distancing, who is inspecting to make sure that the industries are practicing social distancing? Whose responsibility is that?
So this is, well, the responsibility would follow any entity that put regulations into place. But as was alluded to with our police, we don't have the staff to be going in and enforcing that. We're hopeful that folks are, out of abundance of caution for their own business enterprise, are doing that, and through example and the legislation y'all passed, as well.
So if there is a concern or a complaint, who gets that? They don't feel safe. I don't know what's going on out there. So who gets that information? Who gets that?
Well, if it's something that relates to the legislation that y'all pass, they can come to my office, or it should probably just come to my office, and I'll assign it as needed.
So the questions I'm getting for now, I can send them to you?
Yes, ma'am.
Okay.
Commissioner Hamby?
Sure. I'm gonna ask two questions, and then maybe we can take some action on this. So, in follow-up to what Commissioner Thornton was asking, so if there is a situation where you have an essential business and employees are told to report to work and they're not practicing social distancing, if that employee feels like they're going to lose their job or something, is there what could be? I don't know if local government has any purview over that or not. So I'm trying to figure out what we can tell those employees in those regards.
If it's an essential business if
it's an essential business and they're not doing the social distancing, and the employee, y'all see where I'm going. I don't know. I'm trying to figure it out myself.
So, for example, if you were a farming operation, which is defined as an essential business, but you had field hands that were literally shoulder to shoulder, how does that enforcement then happen?
Well, and what, if the employee says something, they say, well, you can go home, and I don't, what do you, are there some sort of worker protection sayings on the state level or the federal level that if we pass an ordinance like this that would protect them?
Well, I can tell you
that
that.
may need some research or something, but.
Yeah, we may need to look at that. I will say I have spoken with city managers in other cities who have done things similar to this.
Yeah.
And it starts off with, if there is a complaint, that there is some contact made, and that education is then taken into account. Do you understand? Here's what you need to do. If they refuse to do that, I think somebody brought it up that, we do have the ability to go further than that, but we're hopeful that that's not going to be warranted.
Okay.
And as far as appeals for workplace health things that might be an OSHA response, and Judd, I'm sort of looking at you too, within the aspects of this ordinance, I'm not sure that we've got an appeal system or due process system that would help in that instance.
Well, if you could do some looking into that, because I think that's something that's certainly going to come up, and something that we might, as a local government, how we can address that, and within the timeframe of this ordinance. So with that said, I just want to make sure too that this ordinance expires on April 7th. So I know we have have had a lot of questions here tonight and are getting a lot of questions. And I think, this is a start to help us get somewhere. So hopefully on April 7th, we won't have to continue this, but that's what we're all hoping, I know. So with that said, Mayor, can somebody give us a recap of what's going on here and what we're voting on?
I think I can do that.
Before we do that, can I just clarify something?
Yes.
So, and I don't mean to be harping on this, but I think it's really important that we don't get out of our lane. But I want to be clear that what we're talking about is we're talking about this. This would not apply to basically other governmental entities that we basically don't have the authority to tell what to do.
That's clear, and that would be one of the amendments, is striking the public language regarding educational institutions, given that we don't have.
And I just want to make clear, because at the bottom of page 6, there's also under E, it talks about for-profit, non-profit, or educational entities. So we just need to be very clear, I think, who this does and does not apply to. And I'm concerned that we may be getting out of our lane on some of these things.
The bottom of 6 is sort of an allowance, so I think it provides the opening for those, but I think the closure question is the one that was critical. So one of the changes was striking public from the schools, both.
Where is he talking about? Where are you talking about on 6, Mr. Mayor? What item number is that?
Commissioner Harrod is looking at 6, page 6, toward the bottom, letter E.
It would be 10E. That's at the bottom of page 6 of 11.
Well, we can add private educational entities there, Mr. Commissioner. That might be a nice change.
Okay, I'm fine with that.
Okay, so clarifying that educational institutions that are covered here are private, striking the word public, adding language that Commissioner Link provided earlier about partners. She's got a couple other, let me find it, I apologize.
Significant others.
Significant others or partners. Or household members in that litany. Adding Commissioner Denson's direction of the prosperity package, but sort of freeing the categorical areas within that so that some or more funds may be devoted to businesses than nonprofits or those worker needs, understanding that will be fluid. Believe those were the changes made.
And not limiting it to the prosperity package.
Yeah, and looking toward other resources as well. And of course, FY21 is specifically called out here.
And did you mention already my amendment of specifying what entities could be called upon to enforce compliance?
Yes, so the entities called upon to enforce compliance would be those other unified government departments.
I need some guidance on that. Where is that change?
So that's page 9, section 11. Pursuant to the laws of the unified government, specifically subsection E of section 3411, the Athens-Clarke County Police Department and others deemed necessary by the manager under this declaration may support compliance through engagement and information delivery. So what entities that are referred to there?
So we just replace others deemed necessary with other unified government departments.
Sure.
I don't know why I see under 11A? No, what?
11, yes, 11.
Others deemed necessary would just be replaced by other unified government departments as deemed necessary. Commissioner Wright?
Thanks, Kelly. Mariah, I appreciate that you brought that up. It seems like hours ago, but I think that if we did it countywide, wouldn't that allow the sheriff's department to help? Because they're not specifically under unified government.
Well, I would think that they are a part of unified government. They're not under the manager's supervision, but I think you bring up a good point. But that should include the sheriff if we say the unified government.
Okay. All right. Thank you.
Okay. Attorney Drake?
I think it's an essential infrastructure, but I just want to make sure. I was commenting that I was a little concerned about funeral homes and making sure we had those covered. I think it'd be essential infrastructure, but
Yes.
Yes.
we don't want to.
So let me just read into the record that we perceive funeral homes as essential infrastructure.
Yes.
Commissioner Neesmith?
You know what's, I wish we had time to do this a little differently, and that is, I know businesses, beauty salons, tattoo studios who have for over a week been staggering their appointments so that there was never more than a couple of customers and always at least 6 feet away all day long. Yeah, with tattoo. Well, with someone's delivering the service. Okay. Well, and you got somebody in the salon too that's taking care of the customer. But they're practicing good health. They've got the hand cleaner at the door, and I just wish we could find a way. We're not going to do it tonight. I'm not saying that. To in the near future come up with a way to encourage these small businesses to be able to open back up by practicing some set of good practices that assures that the probability of infection is extremely low. So that's food for thought. Maybe we can get to there by 1st of April.
Yeah, let's get this going and see what impact it has. That's what we need to do.
Oh, we know the impact.
So,
All right, folks, I think we've.
I'm sorry, Kelly. I
Good,
just
go
want to
ahead.
make sure we don't gloss over some of Commissioner Thornton's concerns. And Attorney Drake, I'm looking at this, and the question is, if businesses are not observing proper social distancing practices, do we have the ability through this ordinance to go in and do something about that? And I've glanced through this. I don't see that in there, but I could be wrong.
Well, covered businesses, any violation of this order by covered businesses shall be considered ordinance violations subject to the general penalty provisions outlined in section 115 of the official code of Athens-Clarke County. That's under provision number 11. So if someone is not observing the 6 foot, I think we could do a code violation.
But is that, I mean, I see where there's a prohibition on mass gatherings, a shelter in place, prohibition on gatherings for entertainment. or
Social
dining
distancing requirements under section 10J, for purposes of this order, social distancing
Okay.
requirements includes maintaining at least 6 foot social distancing. I will point out, though, I mean, in some of the essential business language, it says to the extent practicable, I think. So I think that may be there. I've seen so much.
Okay.
There's the understanding that somebody may have to hand a tool to another individual or the like.
Doctors have to touch patients.
Thank you for answering that for me.
Just one more thing, real quick. So April 7th, we've talked about being in here. So I guess now I'm wondering, what is there, are we going, during the next few weeks, when we see what's going on and we see the studies and we see what the doctors are telling us, will we, I don't want to get to April 7th and we're back here on the last minute stewing over what's next. So if we could be on top of the game during that period of time and meeting with the doctors Jerry's talked about and other folks who know the trajectory of where this is going and what we should be expecting and just planning out for it. So anyway, I know that April 7th's here, but I just know that if it needs to go longer, we need to know before April 7th.
Manager Williams, can you speak generally to the updates you'll be providing with the kind of multi-organizational consortium?
Yes, and if you'll have noticed under the administrative branch of our NIM structure, we do have an advanced planning section headed up by Sarah George. And that, we're planning on looking at the data and the trends to try to assess what I think we're all looking at the curve right now, and what you're going to vote on tonight is meant to sort of slow that. And if that needs to be continued, we will try to provide you some recommendations along those lines in advance of that night, so that any appropriate action could be appropriately noticed to the public.
Thank you, Manager.
Sounds good.
All right, everybody ready for vote? All right, Clerk Spratlin, roll call.
Hamby,
Yes.
Davenport,
Yes.
Parker,
Yes.
Link,
Yes.
yes or no?
Yes.
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 Wright,
Yes.
Denson,
Yes.
Naismith,
Yes.
Edwards,
Yes.
Harrod. Harrod,
I think we've lost Commissioner Harrod.
Yes.
Oh, there he is.
all right, Thornton,
Yes.
10 yes, 0 no.
All right. Everybody, thank you for your very hard work. I know that this has been challenging as we organize it, and it's challenging for every member of our community, small business owner, resident, student, everyone. Just appreciate everybody's diligence and willingness to spend so much time in this chamber. And I know in conversation with members of the community, I do want to reiterate that every public comment entered through the portal is entered into the record, and so that is in the record of tonight's meeting. So I appreciate all those many hundreds of comments that we received.
Mr. Mayor, may I just want to express to the public how we're trying to do the best we can. People are going to suffer. This is our unusual times, and I'm sorry that people are going to hurt as a result of the pandemic and what we've had to do to try to flatten the curve. I wish we had a better way. I really, really do. And we'll continue to work hard. Every commissioner on here is working very hard trying to answer the questions and learn. The attorney is working extremely hard, and we're doing the best we can. And it is not perfect, but I'm not sure there's a perfect answer.
I'd entertain a motion for entrance into
So moved.
Executive session.
If I might.
Yeah, Manager
under
Williams.
Discussion, sir. Well, first off, I want to ask that everybody that's online now, as far as the WebEx, the commissioners, please hang around for the executive session. And I want to thank the public for their patience with this adaptation that we're having to make with both remote dialing in of commissioners as well as sound. And I just want to thank our public information staff, Jeff Montgomery, Todd Dickey, and Jason Harwell for all the hard work they've done to try to make this. And again, I appreciate the public's patience as we perfect it.
You're here. All right. All in favor of leaving public session, entering executive session?
Short break?
Aye.
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 All right, everybody, take 10 minutes, please. Please.